Hello, and welcome to Crucial Conversations by the Nashville Chapter of the National Association of Black Journalists. I'm Sandra Long Weaver. I am a founder of the National Association of Black Journalists. And today our guest is Lawrence Griffith, who is the CEO and the founder of Digital Factory. And you'll say, well, what is Digital Factory? Digital Factory is crucial, especially in these times where we're looking at the number of cases for COVID-19 going up. His company can help do the contact tracing. We'll talk about the contact tracing and what that means in a few moments. So hello, Lawrence. How are you today?
I'm good. I'm good. Happy to be here. Thank you.
Oh, and thank you for joining us. So Digital Factory was started in 2016.
That's right.
And not with the idea, we didn't know about COVID then, but why did you start the company? And then let's talk about contact tracing and why that's important.
Sure. So Digital Factory is the next generation of data analytics company. That is how we sort of define ourselves. But we collect data through the lens of mobile. So there's really two products that we have on the tech side. One is called microfencing and one is called Dwell. We've essentially written software that causes geofencing to be hypersensitive and hyper accurate. So instead of only being accurate within 500 to 1,000 feet, our micro fences are accurate within 5 to 10 feet, can take on any shape we want. But once we plug that into the back end of a native app, for example, like a fast food restaurant app or a retail app, we can now place micro fences anywhere in the world we want. If you have your phone, you walk into it, it causes the app to open and talk to you first, even if the app is completely closed. On the other side is called Dwell, and Dwell is the opposite. Instead of having preset micro fences, once it's plugged in, every time you stop, Dwell creates a micro fence around wherever you're sitting or standing, and it stays there until we move it.
Oh, I see. Okay. So this app you've now adapted to do contact tracing. And contact tracing ties into COVID when someone has been diagnosed with having the virus, and then the questions are asked, well, where have you been the 2 days prior before the symptoms actually show up? And that helps to identify someone that you may have exposed to the virus, and then they can then self-quarantine staying at home, which helps save lives. Is that an accurate description?
I'm sorry, go ahead.
No, and then I was going to say, so then how does the app help with the contact tracing?
So it's the Dwell side that really applies to the contact tracing. And the irony is Dwell was already built to do contact tracing. That's just not how we were using it, right?
Right. So Dwell was built before we even knew about COVID.
Dwell was built long before we even knew about, years before we knew about COVID. So the way we first leveraged Dwell is we had a huge customer in the UK who would have these huge concerts, 80,000 people, 7 stages, 200 vendors, and they wanted to understand how people were moving around the concert. So we plugged Dwell into the back end of their app. So what Dwell does is every time you stop, you have Dwell plugged into the back end of an app, a native app on your phone. Every time you stop, Dwell creates this GPS marker around wherever you're standing. So we can make it so we could say every time someone stops for more than a minute or 30 minutes or an hour, whatever the case is, whatever the time interval is, Dwell is going to create this GPS marker around wherever you're sitting or standing, and that marker will stay there until we move it. And it can be visualized on an analytics platform that we built that is viewable from a PC or from a phone. So we were able to tell that customer how people were moving around the concert, which vendors were most popular or unpopular, right? Where are folks spending their time? Now let's fast forward to COVID.
Okay.
Now you want to understand, okay, so if someone has been marked by the health department as infected, where have they spent their time over the past 2 weeks?
Right. Mm-hmm.
And Dwell can actually tell you that.
So
naturally.
They would download Dwell on their smartphone?
No, the way it would work is typically we work with municipalities
Okay.
and states, and just starting to work with some healthcare organizations.
Mm-hmm.
So some of the key scenarios here would be a city mandates that all first responders have an app on their phone that is owned by the state, right? So it could be the health department app, for example.
Right.
All we're doing is we're plugging in our tech into the back end of that existing app. We can give you one if you don't have one, historically we're plugging into the back end of what you already have, and then that way we now know sort of where you're spending your time.
So first responders go out to, let's say, one of the demonstrations, social justice demonstrations, and they now have this app, so they can see if they're going into an area where someone may have been infected with the virus already and avoid the exposure. Is that?
They would be able to understand three things.
Okay.
If there were other folks there that were plugged into or using Dwell, for example, they would actually be able, or they meaning the health department or whoever's managing the software, they would actually be able to see that 100 or 200 or 5 people who have been exposed or infected, right, were at that same demonstration. And this first responder was within 5 feet of that person or those persons, or this area
right
that first responder is going to has a high rate of infection.
Okay.
Or now the first responder has now been infected. Now let's see where they were again over the past 3 weeks. So there's lots of robust information that can be learned from an analytics perspective that really gives whole new meaning to contact tracing.
It sounds like it does. And my understanding is you are the only African-American owned company in the country that is able to do this type of contact tracing, connecting to your phone and looking at it from that perspective. So with your involvement as an African-American man, we look at the data is also telling us that people of color, African-Americans, Latinos, are being impacted disproportionately to other populations in the country and either contracting the virus or dying from the virus. And so is it accurate to say that this technology can help save lives, especially African-American lives?
It is more than accurate, actually, to be able to say that. I mean, I think not only would it help save lives for sure, but it will absolutely help municipalities, health departments, healthcare organizations better really understand underserved populations, and thus begin to understand how to help those populations.
And that's critical, especially as these numbers this is mid-July, we're having this conversation, and numbers are beginning to surge again in at least 40 states. So, and as a result, some health departments have fallen behind in the contact tracing. So the numbers are surging, but we don't know where people are. So this can also help with some of that backlog.
Yeah, I think it can help tremendously with the backlog and diminish the amount of time that it takes. I mean, keep in mind, okay, so you call someone on the phone, you know they've been infected, you get that part, you understand that from the health department, and now you're forced to rely on their memory in regards to where they've been.
Yes.
Or rely on the fact that they're going to tell you the truth about where they've been.
True.
So our goal, so first of all, at the outset, at Digital Factory, we develop technologies to better the human experience. That's why we do it. Okay. There is no other reason, right? That has been the sort of reasoning or thinking from the very beginning. So that said, if we're able to begin to leverage our tech to keep people safe and to begin to understand populations, to save lives, to take a lot of the burden off of first responders and health departments who are falling behind because the cases are beginning to outnumber the number of people we have to do contact tracing. That just makes sense to me.
Oh, it makes a lot of sense. So what is sort of the next step? How are you getting this out to more populations? I know some local governments have been looking at it, some health departments. So are you throughout the country? Are you in other parts of the world?
Yeah, so Digital Factory has a global client list. We've done business in the UK, we've done business in China, so we've done business on a global scale. But right now, in regards to contact tracing, our key focus really is here in the United States, and really making sure that that we help sort of stabilize things. So as you can imagine, we get contacted fairly often. There's lots of conversation and development and ideation around how this would work, while at the same time ensuring that we are within the guidelines around privacy and CDC guidelines.
Yeah, and that you raise a point about privacy. And when in doing this and looking at contact tracing, I think one of the things people have been resistant to is to share the information of where they've been or who they have been with. Sometimes there's a reluctance, and that so this will allow you to see where they've been. Is it in too much of an invasion of privacy, or is it just at the right level when it comes to public health?
There are social media companies that got into a little bit of trouble because they were collecting a lot of personal data, first, last name, your personal address, under the pretense that it would only live within their ecosystem. And of course, we know now that isn't always the case. We don't ever, under any circumstances, sell personal data. Number one, we don't collect personal data, right? So for example, whatever information you've given the health department, we don't have access to. All we're doing is collecting behavioral data. Let's be clear about that.
Okay.
So even when we talk about HIPAA laws, we don't collect medical data. We don't see medical data. We don't care what bar you've gone to or anything of the kind. None of that stuff matters to us. This is only about saving lives, period. That's it. So we collect the behavioral data. We aggregate that to the appropriate authorities or departments, who then will aggregate it and layer that with the data that they already have about you, that you have willingly given them to help squash this pandemic.
Okay. All right. Well, that you make a very good point there. And so even as this company, Digital Factory, is focusing on the contact tracing, you're still developing another company, Human for All. Can you tell us just a little bit about that company?
So, so we just launched a new company called Human for All. We were getting a lot of inquiries around how we can use our tech in the sort of healthcare vertical. And so we put together a very strong team of high-level physicians, healthcare executives, and we started a company called Human for All. So it is humanforall.com. So humanforall.com is all about tracking your healthy behaviors, right? And you sharing that willingly with physicians and with your healthcare provider. Okay. And having the healthcare provider incentivize you, right?
Okay.
That makes sense. So now, you know, if you could imagine, if your healthcare provider says, or your healthcare insurance company says, we're going to incentivize you by, I'm just, you know, giving examples here, lowering your premiums or sending you a check at the end of the month, for example.
That's a good thing.
Because we see that you go to the farmer's market, or you're walking instead of driving, or you're at the gym for so many hours per month. That makes sense to me. I think that's an ecosystem that incentivizes people to be healthier. It incentivizes the healthcare insurance companies to provide you with cheaper healthcare, and it helps your physician begin to really understand more about your habits, which allows them to give you better healthcare when you see them.
Okay. All right.
Hence we develop technologies to better the human experience.
Yes. And it sounds like, especially, well, I'm glad to hear about Human for All and the work that Digital Factory is doing in contact tracing, because it will make a difference in lives, but especially people of color, and helping to save those lives. So I'd like to thank you, Mr. Griffith, for joining Crucial Conversations today. This is a crucial conversation that more people need to know about, and it can change and help improve the human experience, make our lives better around our country, which is what we need now. So I'm Sandra Long Weaver. I am signing off, and I will see you the next time with another crucial conversation. Thank you so much.
Thank you.